sub-Q, we're gonna open the doctor's orders and also usually we have cards facing down and you will pick one and it will tell you that the time that you're gonna give the medication. The thing is, it's not gonna say, oh, give furosemide or NPH insulin. It's not gonna say that. It's gonna tell you the time because it's part of the test that you know where to look at, which document first that you're gonna open or look at, and how to find the medication that you need to administer. So you need to open the MAR first. Let's say if the teacher, it's up to the teacher, if she decides just to give you the time, give medication at 7. Let's say she said, give medication at 7 or 10. So you open the MAR first. The doctor's order says the time, but this is actually the frequencies, like twice a day, 3 times a day, or every day, or every AM, So, but the time is on the MAR. The specific time is on the MAR. So you look at the MAR first, and you can tell the teacher, I'm gonna check from top to bottom which medication is 10 a.m. Okay. You want me to show you also the NPH or the insulin? How to mix the insulin. I'll mix the insulin, so just in case the teacher tells you to mix the insulin, all right? So let's say the teacher told me, okay, but during the test you only get one medicine, all right? Unless you're giving insulin and the teacher tells you give both the NPH and the regular insulin. That's when you're gonna get 2 medicine, the NPH and the regular, all right? So I'm gonna show you both the IM and the sub-Q. So I'm gonna do the furosemide as well as the NPH and the regular insulin. So I'm gonna check from top to bottom which medication I'm giving. So I'm giving furosemide and regular insulin and NPH, and you can verbalize to the teacher what you need to check for before you prepare furosemide and NPH. So for furosemide, this is a diuretic, potassium wasting diuretic, and so I need to check the potassium level and also if the patient's kidneys are functioning. So because you cannot give this if the kidneys are not functioning, all right? So you need to check for BUN and creatinine as well as the urine output, all right? If you give this and then the potassium level is very low, the patient is gonna have a problem with her heart contraction, and this is a very, not too loud, ladies. And this medication is a very potent blood pressure medication. So you need to check the blood pressure. If it's let's say below 60 for diastolic, below 90 for systolic, then you cannot give this, all right? So check the blood pressure. NPH and regular insulin, you have to check for blood glucose, all right? For regular insulin, you need to check the finger sticks. Usually, we don't really check for, but you need to, I guess you need to. Yeah, the NPH insulin. You check the chart. If the finger sticks is low, you don't give it. So this one is based on the finger sticks or blood glucose. So let's say the teacher told you, okay, our blood glucose right now is 400. So how much are you giving? 10 units, all right? So let's say, so 15 units, you're giving 15 units of NPH and 10 units of regular insulin. So I'm gonna compare the MAR against the doctor's orders. I'm comparing the 5 rights: right patient, right medication, where's mine? Right medication, right dose, right route, right time, every day. And then NPH, I'm checking the medication, right dose, 15 units. Route, subcutaneous, every AM, so the same. And regular insulin, regular insulin, and I got 400 units, 400 finger sticks, all right? And I'm gonna give 10 units, all right? So that's 5 rights, and then you verbalize I have my 6th right, which is right documentation. I will check that later, all right? Because you will document later. You have to check if the patient is allergic to the medicine, and KDA means
No known drug
no
allergies.
known drug allergies. And you need to check if the doctor signed the order, all right? So after checking those things, you can minimize the doctor's orders, and you can maximize the MAR, because you only need the MAR. Okay, you can wash your hands, gather your supplies. So I'm gonna gather, I hope we have, because yesterday there were people practicing, let's see if we still have our supplies here. All right, so you need to use, for insulin, you only need to use insulin, and you don't need to get needle because it's already attached, all right? You need to get your alcohol, all right? Alcohol, all right. So for IM, you can grab, let's open also the patient's drawer, because it might close. You see it's counting down, all right? IM is 22 gauge. And we need 2 of the IM needles, all right? So this is for IM, 3 cc and 2 22 gauge by 1.5 inch. All right, so close this. Oh, we don't have to close it. And then we can close this now. We're gonna do our first check. We need our MAR in front of us when we do our first check. Here it is. I'm doing my first check, so when you take it out from the drawer, when you take out the medicine, that's when you do your first check. Chelsea Abbott, furosemide 40 milligram, I'm taking 1 ml, expiration date. And the room is the same, all right, that's cool. And then we're gonna grab our NPH. Okay, Chelsea Abbott, I'm doing my first check for my NPH, NPH insulin, and I'm taking 15 units, all right? The 2020, so the expiration is good. And I'm gonna do my first check for my regular insulin. Chelsea Abbott, let's see if it's the right person. Chelsea Abbott and regular insulin. I'm taking 10 units, and because I got 400. Expiration date, it's cool. All right, so you scan this. You scan this, scan. All right, so scan after you do your first check, and then you do your second check, all right? So I was telling everybody, do something to separate the first from the second. That's what we're gonna do. Well, we have to scan anyways. So scan it, let's do the second check. Chelsea Abbott, all right, 40 milligrams furosemide, all right. I'm taking 1 ml, expiration date, it's cool, all right. So you can wipe this. After you do your second check, you just have to wipe it right away, because you might forget it if you don't. All right, so NPH, Chelsea Abbott, second check for NPH. I'm taking 15 units, expiration date, it's cool. So grab a new one. Let's pretend it's a new one. All right, just wipe it like that, okay? Second check for regular insulin. Second check for regular insulin. By the way, you can also check if there's any like particles or discoloration, all right? Make sure that you also check that one. And expiration date, all right, it's cool. So I'm gonna wipe it, all right? This one, you have to make sure that you mix, all right? You mix this, all right, so mix this. This one really needs, this one has really particles, all right? Because it has the protein, all right? So don't say, oh, this is really bad because it has particles. No, it should have particles of proteins. All right, so that's our second check and we wiped them already. And then let's do this one first. Let's do the furosemide. All right, so we can leave this over here. Open it first, and then so it doesn't really matter if you start with the needle or as long as you keep all the sterile parts sterile, that's fine. You know. All right, so we have to twist this. Make sure it's secure. You don't want to leave the needle on top of the medicine, right? So we're gonna usually I tell students to go like this when you take out the cap because you have more space if you go like this. If you go up, you might come back and poke yourself, you know, or you know, it's for safety. So we get 1 ml of air, right? And then we will go over here. So you don't need to hold the bottle because if you have your hands here and you're shaking during the performance exam, you might stub yourself, you know. So for safety, you put the needle in first. All right, so in the middle. Why is this right like this? It's so hard. Okay, so we put the air in, and we're gonna make sure that the needle is below the level of the medicine, and don't touch the plunger, right? Everybody, you have to practice because yesterday somebody was practicing and over and over she keeps on forgetting that she's touching over here. I know it's hard. That's why we have to practice because we have never done this before, so it's kind of hard to do, you know, to remember it, you know. That's why we have to practice. So I usually put more than one and flick it hard, flick the syringe hard and push it back, all right? So like this. All right, so we are gonna go over here. Okay. If you don't have this, the best way to recap, because you haven't used this technically, you put your over here, and then you the cup, and we go like this. You scoop it. Do not, because I saw somebody going like this. Do not go like that. All right. So that's how you get poked. You know. All right. So we go like this, and we will do our third check. Let's finish the furosemide checks, all right? We have to check the patient's name, so I have to hold it like this. Okay, Shosia Abbott, room 215. I have my furosemide 40 milligram, 1 ml, 1 ml. Okay, expiration date. All right, so putting it in. All right, so I'll put this over here, because I need this for my. I will verbalize. I will change this, the needle, to prevent irritation to the muscle layers. All right, just verbalize it. Don't do it for real because we're not going to a real patient. We're going to the cheesecake. All right. I'm sorry, the injector pad. Injector pad. All right. So, all right. So. This one is for our insulin, all right? So 400. Remember, our finger sticks is 400. Uh, there are two ways to do this. You can put the amount, let's say 15 ml of, 15 ml, 15 units of insulin air, or just first in the NPH, and then get like 10 units of air for the regular insulin. Or you can add them, all right? So add them, that's fine also, it's even better because it's, you save a little bit of, time, just a little, but it's. So 10 plus 15 is 25. So we go all the way to 25, all right? We go all the way to 25. And then, did we wipe this? We did, right?
Yeah.
Oh my goodness. All right, so we will put our 15. We will leave 10 of air. And then we go over here, all right? All right, so be careful because this needle is fragile and the bottle is kind of heavy. So make sure that you keep it steady and keep it, support it, If you leave it, it's gonna bend the needle, all right? So always hold the bottle. All right, so we're gonna get like 10 units. I do keep on saying ml. 10 units, all right? And then we're gonna go over here. See, you have to always like watch out for the needle, all right? It's very fragile, it might bend. So we will go straight to 25, all right? So we're gonna go, it has to be precise. You cannot pass 25 because you cannot push it back, all right? So make sure it's precise, all right? So we will recap. We have our cup here. Okay, and do your second check, all right? So second check always with the syringe, all right? So doing my second check, Chelsea Abbott, NPH, okay, I took 15 units and expiration date. All right, so you can move this up. Well, I have to check the patient's name over here, Chelsea Abbott. We can go way down. Regular insulin, I took 10 units and expiration date. All right, so that's your first check. Check it's 25 altogether, all right? And then we will go to the patient's room. So we changed this already. We're gonna go to the patient's room. We can wheel this, but we will put it anyways in close to the bedside, so you don't have to wheel it inside. So, and you can even leave it over here, all right? So, you can, well, we wash our hands already, but if you want to wash our hands again, that's fine. Wash your hands, and then you will introduce yourself. Hello, my name is Marlene. I'm your nurse for today. What is your name? What is your date of birth? Check the ID band and scan. Since this is close to you, you scan it, all right? And then we will explain what we're giving. I'm giving you Lasix or furosemide. This is diuretic, all right? And I'm giving you also your NPH and regular insulin. Are you allergic to those medicines? Always ask, all right? No, all right, so that's good. All right, so at this time, your teacher will ask you for one site. If you're giving an IM medication, you're gonna give one IM site. So if you're giving a sub-Q medication, you're gonna give one sub-Q site. So for IM, we have deltoid, vastus lateralis, and ventrogluteal over here. Over here, all right? So the way to find the deltoid is we will palpate the acromion process. And 2 finger breaths below the acromion process, we will also look for the axillary line. And then we go make a V on top of the axillary line and put it in the middle of the V. All right? Do you have any question with that one? Oh, by the way, the sites are in the checklist, the procedure or the steps. All right? So, vastus lateralis between the greater trochanter and the patella, you're gonna divide this into 3 equal parts, and we go in the middle lateral. All right? Ventrogluteal, we ask the patient, it is better if the patient is facing you versus going like this. But, you know, so going to the other side. So we can ask the patient to go sideways like this and bend this or flex the knees, because when it's flexed, the knees are relaxed and it's easier to go in. The needle goes in easier. So you can tell the teacher, if I'm using the left hip, I'm gonna use my right hand, all right? And vice versa, all right? Right hip, you use your left hand. All right, so with your fingers pointing towards the head of the patient, you're gonna put the heel of your hand or palm on top of the greater trochanter. And your pointer is on top of the anterior superior iliac spine. And the middle finger is on top of the iliac crest. And we go in the middle of the V. All right? You have any questions? No? All right. So that's the ventrogluteal. For the sub-Q, we have the upper outer aspect of the arm, and the thigh over here also is almost like, but it's up front, almost like the vastus lateralis, but it's up front. Between the greater trochanter and the patella, you're going to divide this into 3 equal parts, and you go in the mid-lateral, all right? And then by the abdominal area, you can tell a teacher, you know where the lowest, the rib cage is? Below the rib cage, or the costal margin, we call it the costal margin, and the iliac crest, we're gonna go anywhere, just stay away from the umbilicus, like 1 inch, or 2 finger breadths, all right? So you can go anywhere, but you have to stay away from the umbilicus, all right? You have any question with that one? All right, so we just explain it like that, yeah. And then we will go to the injector pad. We will wipe our, you can grab this. You can even take this, the whole thing over here, all right? So, you have to wipe the sites properly, because they want it like that. Okay, it's the proper way to wipe it. So we're gonna open this. I have to ready this. We can put it over here. All right, and then we're gonna open this. And this is in to out, right? You will wait for it to dry, which we're not gonna do during the performance exam because it's gonna take forever. All right. This is an IM. There's only one way. It's 90 degrees. All right. So what do we do first? Not pinch. Spread the skin. Go in. All right. And then do not hesitate, because the patient is gonna get hurt more if you're too slow. All right. Do not hesitate. You just go in. Pushing the medicine is kind of, we do it slowly. All right. or you can let go of the spread and secure it over here and then push it with your other hand. So there are different, as long as you don't move your syringe, that's fine. All right. But that's it, right? And then we cover, we press. Then we will check if it's still bleeding, about 2 to 3 seconds. And then if it's not bleeding, then we're fine now. We can close this, throw it in the sharps, and remove our gloves, wash our hands. We have to talk first to the patient. I'll be back in a few minutes to check on you. Here's the call bell. Call me if you need me. Then document over here. I'll show you after I do my insulin. All right, so this one, there are 2 ways of injecting the sub-Q, 45 degrees or 90 degrees, all right? But usually during the performance exam, because they want to see you how to go, your technique on how to go in and out of 45 degrees, they will ask you, they usually ask to do it 45 degrees for sub-Q, all right? Of course, we will pretend this is new. Okay, we will go in, out, all right? About 2 inches, all right? Wait for it to dry, and then we will pinch, all right? I will pinch. Okay, so bevel up. You look for the bevel. It has to be bevel up, all right? Bevel up, and then we go like this, and then we go push the medicine in, and then we just go out the same way. Went out. That's okay. He's not a real person. Okay. It's still bleeding. All right, you cover. All right, so check if it's still bleeding. It's still bleeding. All right, so this one, the safety device here is this thing. We just push it, push it, and we have to hear the click. Right, you want to try? Want to try? Just push it all the way. There, see? You hear the click, click. All right, so we will remove our gloves. You can remove this now. Okay, this one goes in the sharps. We don't have sharps over here. That's the problem. We will go to the, of course we have to talk to the patient before we go here, wash our hands. And then we go over here. The documentation is part of the test. We have to look for the right date, all right? Sometimes when I look at after the test, I see initials over here. This is wrong. There's no date here, all right? The dates are here, all right? It's supposed to be for 1 week, all right? So we will, whoops, let's pretend that's the date. So we will put our initial, and then I also gave NPH, so your initial. I also gave this one. So if you're giving, in the performance exam the regular insulin, you need to type in the finger sticks, all right? So let's say you got 400, you have to put in 400, and you put just slash there or comma. You can put comma, it's up to you if what you want. But the dose is 10 units, right? So we usually put in the whole word, right, 10 units. And then you will put in your initials, because they want to know who is Marlene, all right? Or who is MC, okay, your full name. And then you will put in your title. You can put in your title there, all right? And then you will tell the teacher, I will also document in my nursing note what I did, the date, the time, the medication that I gave, and how the patient tolerated the medicine. Do you have any, that's it, you pass, okay? Do you have any questions?